March 15, 2021.
Motion to approve.
Second, and
All in favor?
I. So that approved. I'm told that there are no public comments today. There are no people in line, no residents in line to comment on this in this meeting today. And I don't have anything online or in my email to be read. So we can move through that. Having no public comment, we'll go to the department updates and we'll start with fire.
Thank you, Pankaj. Excuse me. I just hit a couple things on the report, and then I have a couple other items. Month of March, we responded to 62 calls for service, bringing our yearly total up to 161. And last year to date for that same period was 134. Training hours, we recorded, 568 and 0 injuries. We put on 1 new member. We had 1 resignation. The member moved out of town. And we have 74 people in the department, 63 active, but as of today, that number is up to 67. We would like to thank the council for allowing us to come before the council in the first, I believe it was March 1st, to promote 2 line officers to position of deputy chief. And we promoted 2 firefighters to position of acting lieutenants to fill their vacancies. And those 2 members were also awarded the department's Ribbon of Valor. From the apparatus side of things, approximately 80% of the department's self-contained breathing apparatus tanks has been successfully hydro tested. We expect to have the remainders done by July 1st. And just a couple other small things here. I want to mention that the department's rescue boat will be in service by the end of this week. And it will be trailered for a few weeks and then moored at the public safety dock. I anticipated being in the water by about the first week of May. We also have reached out, as we do every year, and gotten together with the neighboring towns just to make sure we're all on the same page when it comes to any type of events on the river. And they're starting already. Portland and Middletown had a overturned canoe with the occupant clinging to the canoe in the river earlier today. From the training side, I just want to mention a couple things here. We had 2 officers obtain their state certification as fire service instructor level 1. We have another officer currently attending the certification classes, completion expected in about a month. And recently, 2 officers obtained their fire instructor level 2, which is extremely important, as having this level of instructors is required for our department to manage our own live burn training evolutions. We are currently in the process of certifying 13 members for the Q endorsement on their driver's license. This is a newer process through the State Fire Academy and in cooperation with the Department of Motor Vehicles, which allows us to certify our members for a Q endorsement on their license. We hope to have that done within the next 2 weeks. And lastly, happy to announce that we have received delivery of our long-awaited fire blast training trailer. We expect to have the factory training completed in the next month and the trailer commissioned and operational by the first week of June. And that's what I have. Thank you.
Thank you, Chief. Thank you for that report. Actually, John, do you have a question?
No.
A quick thing on the COVID report, like for the vaccinations. I saw a addendum here, right?
Yep.
An exhibit. So 58%, is that what you would have expected at this point? Are we behind? Are we, on time or as expected?
I know that number has gone up. I don't have where it's at currently. We were expecting more members to get their second shot. We have, well, it looks like 4% awaiting their first shot. So we should be, again, according to the report, this is from our health and safety officers. I would hope 70% complete. I'd like to see more. But it's not a requirement at this point.
Correct. So, but yeah, 70% is kind of like the expected number from the health safety officer point of view, right? And okay, no, I just wanted to, get a sense of like what your expectations were. Your expectations are probably higher, but
yeah, I would love to see 100%. Just due to the type of work we do, and there's not an expectation of what the next call is going to be. So we should be prepared, but again, not requiring it. We've got 7 out of 10. Hopefully that number will go up a little higher. So hopefully the number next month's report will be a lot better.
Thank you, Chief. We move to ambulance.
Good evening. For the month of March, we had 333 calls. Year to date, 1,010 calls. Everything is running great. We have we put a proposal out for a new ambulance. We'll get them in by the 21st. In a couple of days, we'll have all the proposals in, and then we'll go through them, make a determination, and award the bid. And then by the end of the month. So hopefully we'll have a new truck within the next 3 months. That's the plan. Other than that, we're up to 76 members. We have 2 of them in 2 new members that have applied. They're getting their background checks done now. And everybody's doing well and healthy, and life is good. Trying to keep up with everything with COVID, but we're doing well with all of the PPE stuff and everything. So
awesome. John, any questions?
No questions.
I don't have any as well, so we can move on to police.
Okay, good evening all. Last month we had 3,961 calls for service. I'll go through our dispatch center. We had 13 criminal arrests for the month, and we investigated 33 motor vehicle accidents. 47 infractions were issued, and a total of 256 warnings were issued. Our training hours for the month were 283. In terms of staffing, we presently have no vacancies. We have 1 officer who recently graduated from the police academy who's in field training. He's still got another 2.5 months to go. Otherwise, we're at our authorized strength, full authorized strength. We do have a sergeant retiring on May 1st. And we also will be having a second sergeant retiring on September 1st. So, we're working to prepare ourselves for those vacancies. So we posted for those 2 positions. And we have 13 applicants coming in, all certified officers from other agencies to interview this Wednesday for those two anticipated openings. Just kind of an update on the stolen motor vehicle situation. We only had 3 for the month of March, so we're trending downwards the last 3 months, which is good. If you've been tracking the motor vehicle stops, you see that they basically tripled for the month of March with over 300 motor vehicle stops. So I like to think, you know, a combination of the increase in police activity in town, coupled with the fact that some of the big players that have been suspects in this ring have been picked up now and are in juvenile detention facilities. I think between the two, you're seeing a little, hopefully a calm here, but we'll have to see how the next few months go. Other than that, the only thing I wanted to comment on was, as you know, we had a murder in town a couple weeks ago, and I just want to commend everyone involved, from the dispatchers to the officers and investigators who worked on that. Basically, we started with nothing, and within 48 hours, had 3 individuals arrested. So everybody involved did a great job, and I just want to, you know, highlight their efforts. And that's all I have.
Thank you. John, any questions?
No questions. Thanks.
Chief, thank you for putting this chart out there, like adding that chart for the motor vehicle traffic stops. Really appreciate it. I see like that. I noticed that number tripling, and I think that was something which definitely was remarkable in there. And the other part, like which I was looking at, was looks like the motor vehicle thefts were going down, but the thefts from motor vehicles was going up. I don't know, like, is it like a classification issue, or like, you know, that it's more of like, is there a distinction without a difference, or like, is it just like a break into a car? Is that how we define it, the second category?
Yeah, it's that same old problem we've had now for last couple of years. Individuals going into unlocked cars, and a lot of those Punkish are just instances where individuals have gone in, they rummaged through the car, didn't necessarily steal anything, but we still document it, you know, as a theft from a motor vehicle. So it's a combination of the two. But again, you know, the culprit is the unlocked cars.
Right. And I think that's the number to watch probably, but hopefully with the traffic stops going up and everything we are doing in terms of, you know, being vigilant from the public's point of view, and you being out there, like the combination of the two probably will help us get those numbers down. And I mean, it did look like that those numbers were going up in 2019 as well,
Right.
from January to March. So, you know, I mean, I guess we wait another few months and then we'll know what the trend line looks like. But yeah, I mean, those were the two things which I noticed. But I think we'll keep track of those, I guess. And with these open positions, getting 13 applications, is that, again, it's a question similar to what I was asking Chief Gary, like from expectation perspective, is that a good number for you to have a pool of applicants like that for the 2 open positions you're going to have? If I heard you correctly, there were 13 applications, right? All certified?
Correct. Yeah, I mean, that's a good number for 2021, when policing isn't the most exciting occupation right now. I mean, 10 years ago, we would have had a lot more. But, you know, I do want to emphasize, you know, of those 13 officers, there were more applicants, but people were vetted out. So these 13 have been invited to, you know, the oral panel. And again, we're looking to fill 2 positions. So based on the resumes and the experience of the 13 we have coming in, I'm pretty confident we're going to find 2 people to fill those positions.
Yeah, it's a tough time for recruiting, and that's why I asked that question. Like, you know, again, it depends on the expectations. I mean, in a normal, like you said, like in prior years, probably 10 years ago, you'll have a lot more. But from expectation, I think 13 is still a good pool. I mean, it looks that way, but I just want to, you know, ask you about that, like if you feel good about it from a pool perspective. So great. Thanks, Chief.
You're welcome.
Moving on to emergency management.
Good evening. Currently, the Everbridge system for our emergency notification the setup has been completed. The dispatchers are going to be trained in the next 3 weeks with it. And this system does the internal notifications and also does the emergency notifications to the public through CT alerts. So starting the beginning of May, we're going to do a public information campaign for the public to sign up through our website. And we're hoping to have this activated by June 1st. The COVID EOC meetings that we've been running, we're down to once a month while the numbers stay low. If we see that the numbers are going to start to spike again, we'll increase our meetings. But right now, we feel comfortable enough that with the 2% and 3% that we can do it once a month. All the vaccination clinics have been completed, and the summary has been completed in draft form. I'm just waiting for Rich Renstrom to review it and approve it. Per state of Connecticut Department of Emergency Management, I'm still inputting the emergency services staffing status into Web EOC. And for the last thing that I have, which Charles is going to be talking about, we're going to be working with the health district in regards to maybe holding more vaccination clinics based on the Johnson & Johnson vaccination on pause. So that's all I have for today.
Thanks, Jay. Questions?
Nope.
I'm good as well. So that does it for the reports, and we'll now move on to the old business with Charles Brown here from the Central Connecticut Health District, and he's going to talk about vaccines and also the situation, the development situation there in the Apple rehab for the water contamination piece as well. So, Charles.
So let's start off with the good news for the vaccinations. For Rocky Hill, you're looking at about 57% of the population of Rocky Hill has gotten their first dose. So that's very good. Overall, as far as the number of cases, total cases as of the 15th, 1,722 cases. Unfortunately, we're looking at 122 deaths, but that number has been very slow to climb. As you mentioned, we have seen a slowdown in the number of cases. We are concerned at this point that the highest number of cases that we see are actually among a younger cohort than what we'd seen previously. Here over the last several weeks, we've been seeing, folks in the 20 to 29 age range that have actually been the cases most prevalent. So as it moves its way down to, where the virus can find opportunity, I think we're going to continue to see this. Impact of travel is another thing that we're keeping our eye on. Many schools were out for vacation last week. So whether or not we're going to see a spike based upon travel is something we're going to keep our eye on. But I think that hopefully people take the lessons learned and carry them with them. Other than that, Apple Rehab, something other than COVID. So we've actually seen one more case at Apple Rehab. We've actually seen 3 cases there of Legionella since 2019. With Apple Rehab, they are a licensed healthcare facility, and as such, the Department of Public Health actually oversees any mitigation or any investigations within their walls. So I've spoken with an epidemiologist at the state, and they are working with Apple Rehab to assure that their mitigation plans are in place and being followed so that they won't see additional cases. MDC, I think everybody's seen them on the news. stating that the water quality is still not an issue within Rocky Hill. This is really limited to the facility and is not uncommon in some of these places. So they're going to get down to be able to eradicate or to actually mitigate the circumstances that allowed these cases to happen. And I'm sure the Department of Public Health is going to be very stringent, considering this is the third case since 2019. As James did say, we did have some unfortunate, circumstances with respect to the Johnson & Johnson vaccine. They're still on pause. We're expecting probably on Friday to get some news as to how they're going to move forward with Johnson & Johnson. It does impact our plans to do a large clinic at the Berlin Fairgrounds. So we've put that on pause at this point as well. We are looking at the potential of doing smaller clinics to continue our way down through the population. But that's going to, I think, take a back seat for some of the other initiatives that we have kind of put on hold for a little while. One of those is actually reaching out to homebound populations and then smaller congregate facilities like group homes and people that have functional needs to be able to get there. So we're going to meet internally, and then we're going to reach out for any assistance that we might need from the town. That's my story. I'm sticking to it.
Charlie, did you say 60% of Rocky Hill is vaccinated now? I just wanted to, I wrote that down.
Actually, it's I think it was 57%. Yeah, 56.98. So that's having the first dose.
Right.
This is as of the 14th of April. So it's probably higher than that right now. Total doses, the first doses that have gone out as of 11,461.
John, do you have any questions for Charlie?
No, I don't. Thank you.
So Charlie, just a couple of things. I just want to focus on the Apple facility, right? Because it was like this big news item. And like you said, they did put out a statement, I think it was on 15th, I think April 15th. And they said that this was pretty much limited to that one facility, and their general like portable, like drinking water wasn't like really the issue there, right? If I'm like summarizing that correctly. And so going back to this like 2019 thing, like I know this is very much a case of this one facility, but are there any like concerns in terms of like this being the case elsewhere in town, like, with other facilities? Like, do we know, like, is it, I guess, like, is there something proactive that can be done here, or is it a state issue and like it has nothing we can do at the local level?
No, for the healthcare facilities, it's very much a state issue. Generally, what they do when they find something like this, they have, they're monitoring for cases of Legionella at all times. And any case that's healthcare associated, the state does investigate rather quickly. So they do bring in investigators. They do bring in folks that actually put in a mitigation plan when they have a case. When they have multiple cases like this, there may, they become much more stringent, because one case can happen. But the goal really is to determine what's going on in the facility. And it really does impact at a facility level. DPH looks at water quality in surrounding areas, trying to determine where the issue is. And everything right now that they've looked at really does focus just on site. So their mitigation efforts are going to be focused on trying to figure out and fix in the long term what's going on in Apple Rehab. Just like with anything, that's mechanical, things require maintenance, and they require the ability to do proper testing, assure that everything's working correctly, and if something is broken, to fix it very quickly. So healthcare facilities don't have a lot of latitude with respect to that because of the potential of these types of occurrences. That's why DPH is very much on these types of scenarios. So to answer your question, it is out of our hands. DPH has got this, and they do, when they do get cases like this, they do look at surrounding facilities as well, just to assure that there's not going to be a major issue.
Yeah, good. That's great news. That it's kind of limited to this one facility, and we don't have like a bigger, wider drinking problem, on our hands. One last question, Charlie, because I was thinking about the 57% number. What is the number for the entire state? So I'm trying to ascertain, like, if we are doing better or worse in terms of where we are as a town.
Yeah, I'm trying to get the number of
much,
vaccinations for the whole state as a whole. I think is right around, I think we just went over 61%
Okay.
of the population. Yeah, so it's like I said, these numbers that I just gave you are the most recent we have for Rocky Hill. So the numbers may be right there in line with where we are as a state. Nationwide, they were very happy that we went over the 50% mark. So Connecticut as a whole is doing much better with our vaccination rate and pushing them up. And I think that, a lot of this, we're going to see a lot of gains as the younger cohorts who've just been given the opportunity to get vaccinated actually start to get their appointments and everything moving forward. So, good news. I think it's, they've had some major announcements as far as, reopening and things of that nature that the governor's put out today. So we'll have to, kind of assimilate that and see where we go from there.
Great. So yeah, I was just trying to get to like the idea of this vaccine hesitancy, right? And where we are in that. And I don't know if you can, you as in like as the institution of the Central Connecticut Health District can bring more focus to it or not. But I think that will be a place where I think we can do a little bit better in educating people. I don't know if that's just,
Yeah, I mean, we are actually getting a health educator that's going to be starting on May 3rd, and their sole focus is to be educating about COVID and vaccine hesitancy, all the things related to that. So we were able to hire them through one of the state COVID grants that we've gotten that was federal passed through. So their job is going to be doing just what you mentioned, addressing that vaccine hesitancy and really trying to educate people on the things that they should be doing as we continue to progress through this pandemic.
Yeah, Charlie, which agency is this? I missed the name, I think.
The health educator is actually going to be with us in the Central Connecticut Health District.
Awesome. So yeah, it's part of the district.
Yep.
Awesome. So no, I don't have any further questions. So any new business? Moving on to the next item. Anything, John?
No new business.
Thank
And
you.
nothing for other.
Nothing for others. So I will entertain a motion for adjournment.
Motion to adjourn.
Second, all in favor? Aye. Thank you, guys. Thank you so much.
Thank you.
You.
Thank you.